Welcome to Costa Rica. My name is Johnny from Johnny Knows Costa Rica. Today we're going to talk about healthcare, but in regards to disabled veterans, retired veterans, and those of you that are just veterans and you're visiting here in Costa Rica but are active duty. Here in Costa Rica, there's a few hospitals or facilities that do service you, but there's things that you need to know. First of all, when you go into these facilities, you got to find out, are they active? Are they within the system? Are they service providers covered through TRICARE when you're visiting or when you're living here? A lot of things happen here that could be covered, not covered. So you have to ask, are you within coverage? How it works. One of the things that you want to ask is this, is there coverage within the TRICARE network? Is it on the reimbursable basis, or is it direct billing, or is it that you pay out of pocket first and submit the claim to TRICARE? These are the things that you need to find this out before, because what happens is that you could end up with a bill and they may or may not cover it. You're entitled coverage, but sometimes it's tough. Making sure that the paperwork is done right, that the CPT codes are entered, the NDC codes are done. All these things are factors that need to take into consideration. Now, as a disabled veteran, you're entitled to have service around the world, that if you don't have service within your coverage area, within 30 miles of a VA facility, you're able to use it here. But keep in mind, the facility itself needs to make sure, you need to make sure that if you got to pay up front, is it reimbursable? Are you a part of the TRICARE plan that has a copay, that you have to give a copay? Do you give the copay to the provider, or how does it work? The provider itself here in Costa Rica will know how to do that, but you need to know which one it is. There's a few providers that I can tell you about. One of them is the Metropolitano. Number 2, Clínica Bíblica, and other facilities, to name just a few. Now, when I'm naming these facilities, keep in mind that every facility has its own way of doing things and how they receive payment, and especially how it's processed. Being a disabled veteran or being a retired veteran, the way it's processed through TRICARE, it's a different manner. It's on a reimbursable manner here. So you're going to have to pay up front that copay and work out a plan with that provider. You're going to be reimbursed, but just know that up front you're going to have to do that. If you're active duty in here, it's a little bit different. They'll be taking care of you, and it's not up front. But again, you have to ask the providers that I mentioned before, or the list that's listed on the VA website, to make sure that they're within network, that they're being an authorized provider, that they've gone through the process to be vetted with the VA. So you have to do a little homework before you get in there. Now, there's been some other videos that we've helped veterans here in Costa Rica, but this process was a difficult process because, again, this veteran was a disabled veteran, but not only disabled, he was also retired. But in the categories here, how the system works, he had to do submittals, copays that are due prior. So just know that each process is different, and each hospital or clinic has a different way of doing it. I'm Johnny from Johnny Knows Costa Rica. I hope this information was good for you, and you have any comments or want to learn about the services, please write us. Pura vida, and always be safe.